Vomiting in children and babies is the forceful expulsion of stomach contents through the mouth. It is a common symptom in infants and young children and can result from various causes, ranging from mild and temporary conditions to more serious underlying problems. Understanding the cause is essential to provide appropriate care. Common causes. 1. Gastroenteritis, stomach bug. Most common cause of vomiting in children. Caused by viral or bacterial infections of the stomach and intestines, often accompanied by diarrhea, fever, and abdominal pain. 2. Reflux in infants, also known as gastroesophageal reflux (GER). Common in babies, as their stomach muscles and valve control are not fully developed. Typically occurs after feeding and improves by 12 to 18 months. 3. Overfeeding. In infants, feeding too much or too quickly can cause vomiting. 4. Food intolerance or allergy. Intolerance to lactose, cow's milk, or other foods may trigger vomiting. Food allergies can also cause vomiting alongside symptoms like a rash or swelling. 5. Infections, non-gastrointestinal. Ear infections, urinary tract infections, or respiratory infections may cause vomiting as a secondary symptom. 6. Motion sickness. Triggered by car rides, boat trips, or similar situations. More common in older children. 7. Serious conditions. Pyloric stenosis, a condition in infants, usually under 6 weeks old, where the stomach's opening narrows, causing projectile vomiting. Intussusception, a serious intestinal obstruction in babies and toddlers. Appendicitis, may cause vomiting along with abdominal pain, fever, and lack of appetite. Meningitis, can cause vomiting with fever, neck stiffness, irritability, or lethargy. 8. Other triggers. Stress or anxiety. Ingestion of toxins or medications. Head injuries or migraines. Symptoms to monitor. While vomiting is often mild and self-limiting, watch for these warning signs of a more serious issue. Persistent or forceful vomiting, e.g., projectile vomiting. Vomiting green or yellow bile, blood, or material resembling coffee grounds. Dehydration signs. Dry mouth, sunken eyes, or a sunken fontanelle, soft spot in infants. Reduced urine output or no wet diapers for 6+ hours. Severe abdominal pain or a bloated abdomen. High fever or signs of infection. Lethargy, irritability, or unresponsiveness. Vomiting lasting more than 24 hours in a child or 12 hours in a baby. Management and treatment. 1. At home. Mild cases. Prevent dehydration. Offer small, frequent sips of oral rehydration solution, ORS. For breastfed infants, continue breastfeeding. For formula-fed babies, feed smaller amounts more frequently. Avoid giving plain water to infants under 6 months. Avoid solid foods or milk during active vomiting. Reintroduce bland foods, e.g., rice, bananas, toast, once vomiting stops. 2. Medical treatment. For gastroenteritis, ORS and symptomatic care. For reflux, upright positioning during and after feeds, smaller meals, or prescribed medications. For food allergies, avoid allergens and consult a doctor for testing and management. For infections or other causes, specific treatments based on the diagnosis, such as antibiotics for bacterial infections or surgery for conditions like pyloric stenosis. When to see a doctor. Seek medical attention if the child shows signs of dehydration or persistent vomiting. Vomiting is severe, frequent, or associated with serious symptoms, e.g., blood, bile, or severe pain. The baby is under 3 months old and vomiting forcefully. Vomiting follows a head injury or ingestion of a harmful substance. Prevention. Ensure proper feeding techniques, e.g., not overfeeding infants. Practice good hygiene to prevent infections. Avoid giving large meals or triggering foods before car rides to prevent motion sickness. Keep potentially harmful substances out of reach. Vomiting in children and babies is often manageable but requires careful observation and prompt action if concerning symptoms arise.